Hi, my name is Kimberly Hernandez, and this is my thesis presentation on the zones of regulation to improve emotional regulation in a child with ADHD. Between the ages of 2 and 6, children learn when and how to express emotions and begin to engage in emotional regulation. Currently, there are two main definitions when studying emotional regulation. The first is that emotion regulation is a process that occurs within the individual to moderate difficult emotions. The second defines emotional regulation as an individual's ability to alter emotional responses within different contexts, and that's the definition that I used for this study. Difficulty with emotional regulation can result in increased stress, anxiety, and depression in children, and can affect cognitive development as well as educational achievement in kids. Children with poor emotional regulation tend to be less engaged in school and often display hyperactive behaviors and have low educational performance. ADHD in children can affect their ability to perceive emotional responses due to problems with information processing. ADHD is sometimes co-occurring with aggression and is believed to be due to poor impulse control, although aggression is more common if the child has been exposed to aggression in their household. The presence of aggression can make the children very difficult to place in a childcare setting, and this can have very serious effects on the economic, psychological, and social well-being of both the parent and child. Current treatments for ADHD focus on a combination of medication and behavioral therapy. For this study, we use the zones of regulation, which is a curriculum developed to teach children how to identify emotions and how activating they are, then to apply those zones in themselves, and finally, to use emotion regulation skills to reduce the difficult emotions. Utilizing the zones of regulation should result in an increased awareness of emotion and emotionality, and ultimately reduce the frequency and intensity of aggressive episodes in a child with ADHD. The participant for this study was an 8-year-old male student in 3rd grade attending a child care center for people with special needs. He had been previously diagnosed with ADHD and demonstrated considerable problems with emotional regulation. These problems mostly manifested through aggression, and he did not attend school and struggled academically as a result of his aggression. He was selected as a participant with the purpose of decreasing aggression and increasing positive responses to emotional regulation opportunities. The study consisted of an A-B single-subject design. The baseline phase A was prior to intervention, and B is the treatment phase. The variables included the zones of regulation as the independent variable, and our dependent variables were the positive response to emotional regulation opportunities, the intensity of his adverse response to emotional regulation opportunities, and the types of skills that he used during an emotional regulation opportunity. The zones of regulation lessons were done in 30-minute one-on-one sessions and adapted 10 of the 17 available lessons described by Cooper's in the Zones of Regulation handbook. The participant was observed then for 3 hours in a classroom environment, and the intervention was done prior to the beginning of his program day in the morning, and his adverse reactions were measured on a 5-point Likert scale, rating the intensity. So this figure shows the positive responses to the emotional regulation opportunities. So during baseline, we see that the participant was responding positively less than 50% of the time. But following the application of the intervention, he started to have a mean positive response at around 66.6% of the time, and this is during that 3-hour observation period. Looking at the intensity of his adverse responses, we see that during baseline, the intensity of the aggressive episodes were much higher, and then following intervention, they started to lower gradually. Figure 3 shows the emotional regulation strategies used by the participant. So during baseline, we see that he relied very heavily on avoidance and aggression as the primary way to regulate his emotions. Then, following the introduction of the intervention, he started to move towards compliance, but he was really not adding any new skills or new ways to cope with those emotions. Once we got to the part in the intervention where we presented him with more options, that's when we started to see that the amount of positive social interaction he was seeking out increased, as well as his compromise. The results in the study are promising. Applying the zones of regulation decreased the aggression displayed by the participant and increased the amount of positive emotion regulation skills he used over an 8-day intervention period. However, the intervention itself did become a trigger for him initially and resulted in an increase in the amount of aggression he was using. However, this aggression was goal-oriented and aimed at not participating in the emotion regulation lessons and consistent with findings described by Fight in 2009 when he looked at proactive versus reactive aggression. For this reason, it was vital that the behavior not result in the desired goal of avoiding the intervention, and this was accomplished by not reacting to the aggressive behavior and instead waiting quietly until the participant was prepared to continue his lesson. The amount of time that he needed in order to do that eventually decreased until it completely stopped. Some limitations of the study include the short length of time that the participant had, as well as changes in what was expected of the participant, so he stopped attending school during this time. However, by the end of the intervention model, he was able to attend school once again. And so some future directions would be seeing how the zones of regulation work in a single subject over a longer period of time, and the feasibility of using this intervention in child care centers.